Good morning, everybody. Good afternoon, depending where you are connecting. This is Alessandro Di Capo from UICC, and welcome to this new virtual dialogue that we're going to be having today. It's a special focus dialogue around supporting UICC members to succeed in their national advocacy strategies, and is in conjunctions with our Cancer Advocates program. I'm here just to welcome you briefly before giving the word to our moderators and our presenters. Just a few words in terms of housekeeping. Feel free to keep your video on. It's great to see all the faces of people who are joining in for across the world. And please keep your mic muted for the moment, for the time being. We will open up for Q&A after the presentation from two of our country champions that will present their advocacy strategies today. But feel free to use the chat box to add comments or reflection or note your questions in advance, and we can pick up after the presentation. Anyway, that's all from me. I'm just going to pass the word to our own Eniko Yaya, who's a senior manager and leads the Cancer Advocates program. Eniko, over to you.
Thank you, Alessandro, for the presentation, and thank you everybody for taking the time to attend this 1 hour special focus dialogue on supporting UICC members to succeed in their national advocacy strategy. I'm Eniko Yaya, and together with Fanny, we manage the Cancer Advocates program. Today, you will hear from two country champions, Tsegi Batmunkh from the National Cancer Council of Mongolia, and Christine Mugo Sitati, sorry, who is the Executive Director of KENCO, Kenya. You will hear about their experience in the past year as a country champion. You will hear about their learning experience and how the UICC support contributed to improve the effectiveness of their national advocacy strategies. Now that the call for expressions of interest to become a country champion is open, and we'll close the 15th of October. If we can go to the next slides, I just would like to provide you with a brief overview of what the Cancer Advocates program is about. So the program was launched in 2018 following the approval of a landmark cancer resolution at the World Health Assembly. This cancer resolution contained several provisions on ways to accelerate progress on cancer control and reduce the cancer burden in countries. And it also included a special mention to the power of civil society to accelerate progress in countries. So the program stems from this resolution, but also from the needs and requests of support coming from UICC members to receive support in terms of knowledge and skills on how to improve national advocacy efforts. So in 2018, we started with just 3 UICC members from 3 different countries. From Indonesia, from Mexico, and from Uganda. So what we realized is that UICC members needed support and advice to spearhead collective advocacy efforts, joining forces with other organizations working in the same country to amplify their voice towards decision makers, cancer patients, and the general population. They also wanted to receive support to develop meaningful advocacy messages and engage key decision makers to create the political will that is needed to bring about change. They also wanted to receive support on ways to improve their fundraising strategies, or to monitor their advocacy efforts to improve their effectiveness. So as a result, next slide. As a result, UICC produced a wide set of resources and materials. Resources and materials that take different forms. So we produce a practical guide on coalition building, advocacy, fundraising, and monitoring and evaluation, with an initial self-assessment of needs to better assess what the strengths and weaknesses, opportunities and threats are regarding the national country, let's say the country scenario. We also produce a supporting virtual course with recommendation and advice from cancer experts. We linked the 20 countries that became country champions. We linked them with mentors who are representatives from cancer organizations from the world over that have a track record in advocacy. And then we also organized last year in Kazakhstan an in-person workshop with several dynamic sessions based on a two-way communication approach, and also based on a case scenario and hypothetical cases, so that we really improved the collaboration among country champions. So judging from the feedback that we have received in the past, let's say 2 years, we are aware that UICC members that took part in the program, they valued the actionable insights included into the handbook, the increased network of cancer advocates from other countries and regions, the inspiration and recommendations received by other country champions. So we really strengthened the peer-to-peer learning approach, and the advice that they also received from these mentors, representatives of cancer organizations with a track record in advocacy, and also probably most importantly, the personalized technical support. So as I said at the outset, today we have two country champions who are pleased to share with the global cancer community their learning experience, how the Cancer Advocates program contributed to improve their knowledge and skills in advocacy for cancer control, and the national advocacy strategies that they are implementing at country level to reduce the cancer burden. So we hope that their testimony will inspire you to express your interest to apply and become a country champion. The call is open until the 15th of October, and it is accessible through the UICC's website on the section Cancer Advocates Program. So this was my brief introduction on the program, and I'm really happy to leave the floor to the country champions that took part in the program. I don't know if Tsegi she's the founder and CEO of the National Cancer Council of Mongolia. She will be pleased to present her learning experience. Tsegi, if you can hear me, please, up to you.
Domenico, shall we switch, maybe just quickly switch to Christine, and then maybe we'll see if we can go back to Tsegi during the Q&A to ensure that the sound, it's better.
Yeah, oh, thanks. Thank you, Alessandro. I think the problem may be also the earphones, maybe. Yeah, so thank you very much, Tsegi, for your presentation. It really shows how committed you've been in the past month. What you have achieved, and how, for instance, the initial self-assessment really convince your organizations to improve advocacy efforts on childhood cancer. And it's great to see the achievements that you have already made in your country, and we are really honored to continue to provide support in the advocacy efforts of the National Cancer Council of Mongolia. I will give the floor to Christine Mugo Sitati. Christine, she's the Executive Director of KENCO, Kenya. KENCO has come a long way in terms of advocacy efforts in the country. And I will just give the floor to Christine. She will provide a presentation on the learning experience as part of the Cancer Advocates programs, but also the national advocacy strategy put in place and the activities carried out in the past month. So the floor is yours, Christine.
Thank you so much, Nico. So just like you've heard, my name is Christine, and I'm from the Kenyan Network of Cancer Organizations. Please move to the next slide. Next slide, please. Yes, so the Kenyan Network of Cancer Organizations, we are a national umbrella body for cancer civil society. The previous slide, please. So as we move to the previous slide, so KENCO is a national umbrella body. We are a membership organization with over 35 registered cancer civil society organizations. At the moment, we are 36 members, different organizations that are active in various aspects of cancer, be it awareness, it can be education, it can be screening. There are those who take people through psychosocial support and others through palliative care. So our objectives as per our strategic plan is capacity building of our member organizations and health workers. We also support networking of member organizations, collaborations and partnerships in cancer control so that people can harmonize and synergize their plans to use the little resources in cancer better. Then we also have advocacy aimed at influencing government policies, registration around cancer for the benefit of the public. We also have organizational development and forming of linkages and partnerships in cancer control. I have bolded advocacy because this was something very important to us and still is. And before we joined the Cancer Advocates Program, we were members of UICC, but we felt we still had a gap in advocacy. We were not as active as we were supposed to be. We felt the needs in the country in cancer control were really big, and we really needed to address this. And that is why our members, we brought as many members together as possible for that united response against cancer. So when UICC advertised for these, when they advertised for the open call for the Cancer Advocates Program, we thought this would really be a good chance for us, and we are happy we got selected. Next slide, please. So we joined the Cancer Advocates Program in the year 2019, that was last year, and we were announced during the World Cancer Day, and we were paired with our mentor. Our mentor is the American Cancer Society. They have also been our partners in other areas, so it was really exciting to have them as a mentor in the Cancer Advocates Program. And for this program, we decided to do it as a team effort. As the Secretariat, one thing I would want to bring out is that at KENCO, we are a very small team of staff. We are only 5. So this meant that we really had to do this together in a united way. Then we also have an advocacy committee. We are of 15 members that is formed up of different representatives from the different member organizations. And so when we got this chance, we called them for a meeting and we told them we have been selected for a program that is going to help us be better in advocacy. And so we started our work together. And just like Nico mentioned, and from Mongolia also we got to know about the mentorship program. We were taken through needs assessment, coalition building, how to do it. We were already a network, but we needed to expand for us to be better in cancer control. We were also talking about modules in advocacy, fundraising, and monitoring and evaluation. And this was done through various modules that were sent to us, and we had to sit down and discuss them and come up with solutions. There were also videos that, links that were sent to us of videos from different experts, and we were able to watch them. And this really enabled us to grow. Next slide, please. So at the time we were starting this program, the challenges that we were experiencing were things like lack of resources, both as an organization and also for cancer control in the country. It was not a priority for the government. It wasn't a priority for Treasury to release money for cancer control. Then also we had increased cancer cases in the country, high cost of treatment, inequalities when it came to diagnostics and treatment. Most of our cancer centers are in urban areas, so people from rural areas really have to travel far, and also these facilities are not even enough. Yeah, for example, there's only one facility that offers radiotherapy in the country. So we found there are so many inequalities, and these were some of the challenges that we were grappling with. But through peer-to-peer learning experiences, through our modules, then also through monthly county champion calls, we were able to learn from various organizations. There was also the World Cancer Leaders Summit in 2019 in Kazakhstan. And through this, there were various sessions that we could attend. There was networking, there was sharing of experiences, and we learned a lot from this. One thing that we learned was advocacy strategies from different countries. What are different countries doing? Some countries had similar problems to us. So what are the innovative ways that they were using? Fundraising strategies. We got to hear from countries like Namibia, Uganda, what are they doing when it comes to fundraising? For example, in Namibia, I got to know that they actually fundraise through selling of apples in a certain time. And you could see the small doable things that we could borrow from each other. That is one advantage of this program. You get to learn from your colleagues in different countries. Then also on building collaborations, what have others been able to do? So the modules would take us through that, but also the networking sessions, even during the monthly calls when people get to share their challenges, you get encouraged and you learn you're not alone in this, yeah? And it was really encouraging for us. Next slide, please. Yeah, so with all the challenges that we were facing, we felt our advocacy goal was to ensure universal availability of quality and affordable cancer diagnostics and treatment services, and progressively reduce the out-of-pocket expenditure on cancer treatment in the country, leading to a comprehensive package by 2022. It is still costly for a Kenyan with cancer to get treatment, full treatment. It is also the way I talked about, the facilities are far from people, they are not enough. So we felt we needed to address this issue as a very critical issue for us. So our objectives, I've shortened them for the sake of the slide. One was to raise priority accorded to cancer financing, to engage government to progressively lower the cost of cancer treatment, and to engage the National Health Insurance Fund for a comprehensive cover. So for cancer financing here is addressing both the Treasury and the Parliament for them to be able to make decisions that are going to ensure that more money is taken to cancer control. We had data that we could compare that money that goes to non-communicable diseases in Kenya is less than what goes to communicable diseases, yet the number of patients in NCDs is higher. Yeah, so we are still trying to bring out that fact to the government, and we have seen improvement. For example, when it comes to cancer financing, we can say there is at least an improvement when we compare the 2-year budget last year and this year, we can see there's a difference. Then engaging government to bring down the cost of treatment. We even had suggestions. If medication is bought in bulk from the Kenya Medical Supplies Agency by the Kenya's KEMSA, then we are able to get they get a profit, and that is able to be passed on to the patient. Then engaging the National Health Insurance Fund. This is a national fund for every Kenyan in the country. You contribute a small amount, whether you are employed or not. There are different amounts for those who are employed and for those who are not employed. And we realized that NHIF will only cover you when you're starting your treatment. Yeah, but what happens? Our call is for government to ensure that we can actually use this cover to get screened. We can actually have this cover, use it when it comes to diagnostics. So those are some of the challenges that people are having. Yeah, then it is easier for you to get screened and cancer known quite early. It will be cheaper on you if you got to know about cancer when you're in stage 1 rather than in stage 4 when treatment is quite costly. So we broke down this advocacy agenda and we came up with a press release, a document that we shared during we launched this advocacy campaign in this year in February during the World Cancer Day. That is our chair. The photo there is the chair of the board. when she was reading this statement, it was both in English and Swahili, so that everybody could really understand. In this meeting, we had high-level government officials from the Ministry of Health. We had the media in it, so it was really a good chance for us to share this statement. And one thing that we learned from our advocacy campaign, from the Cancer Advocates Program, is how to personalize cancer. We have learned to break down our cancer numbers. For example, from GlobalCan 2018, we have 48,000 new cases of cancer every year in Kenya. But you see, if you mentioned 48,000 cases, people will not really pay attention. But when you break it down and you tell them it is actually 6 patients every hour that are being diagnosed with cancer, it brings the message closer home. And we say that we have 4 people dying every hour from cancer. So this is one thing that we learned. We've also been able, through the Cancer Advocates Program, we have identified various partners. We have even been able to identify media journalists who basically report health, and we formed a group for them. And also members and prospective members, any organization that is doing cancer, we are in discussion with them to ensure that they come on board to KENCO, and we are able to do this together. Then we also learned that we have to be really good in branding and communication, so that we are sending one message all the time, different times, and people will actually learn to get to hear us, and it will be actionable. Next slide, please. So, and the other thing we also learned is, for example, some small doable things in branding. We have learned, for example, every month is a cancer month. So in our emails, our email footer, we usually have that ad ribbon for that type of cancer. So when we are sending information out of KENCO, it reminds everybody who gets to read our message what kind of cancer we are celebrating that month, and it keeps the cancer agenda alive. So some of the achievements that we have been able to get from this Cancer Advocates Program, we have done a lot of public participation and engagement with our Parliament and Treasury, and we even suggested revenue sources where they can get money that can be diverted to cancer. For example, we are active in tobacco control, so we have mentioned about sin tax and how that money can be brought to cancer control and used for various programs. We have even mentioned about unhealthy diets and the fizzy drinks and the sugars and how they can divert that money. So we make noise about it, and we give suggestions that we hope they are going to bring on board. There was a very big case in the country on tobacco control, and we are happy that the High Court ruled in favor of tobacco control actors, and we are now working on ensuring that that fund is actually brought to cancer control. Then increased membership to the network. Last year when we were joining the Cancer Advocates Program, we were only 25 members, but today we are happy to report that we are 36 members, because we have learned the power of working together, power of working in a coalition. We have also had managed to have partnerships with the national and county governments, both through our members and our own members. We invite, when we have our own events, we invite high-level government officials, both from the national government, from various counties, and this ensures that partnership, we keep the cancer agenda alive. We formed partnerships with pharmaceuticals, which have also helped us fundraise through them. We send proposals to them and they fund us, because we have kept the discussion alive that we really need financing in cancer control. And we have one very big achievement is bringing religious leaders on our side. In Kenya, people really listen to religious leaders. For example, when we launched, last year we launched the HPV vaccine, yeah? That is it was a very sensitive discussion in our country. People would associated HPV vaccine with sexual immorality. But we tried to explain to them that this is actually a vaccine against cervical cancer. And we had to bring religious leaders on board, explain to them what KENCO does and why we are fighting for cancer, why we are fighters in cancer control. And we actually had a number of meetings with them. And finally, together with them and the Kenyan Society of Oncologists, we were able to do a press release, and they endorsed the HPV vaccine. And they said they are going to work together with us in cancer control. And now we are in discussion with them on how we are even going to sensitize more religious leaders, so that even in the rural areas and all the other places, the message can be passed even from the pulpits that people need to go for screening, people need to know their cancer status, and even the government needs to release more money to cancer control. Then the Kenya Medical Supplies Agency, we have been in discussion with them about procurement of some cancer commodities, for example, the stoma bags, the quality of these bags, bringing down the costs for the sake of cancer patients who have to spend so much on some of these commodities, lifelong commodities. And one good relationship we've established with them is actually when they have commodities that are about to expire, 3 months to expiry date, we have actually received donations from them, and we distribute them to cancer patients and survivors for free. So this has so far happened thrice last year, and we're really excited by this. Instead of them waiting for all their products to expire and they ban them, then they can give us for free without having to buy. So this is a relationship we developed thanks to getting to know about coalition building, and we're really excited about this. Then we have increased our social media activity on all our platforms. We have a website, we have Twitter, YouTube accounts, Facebook, all that, and we have increased our presence in these social media activities. We've also been releasing regular newsletters to partners, because we learned if we want money from partners, if we want the government to be on our side, then we also have to be accountable. We have to release to them our reports. We have to let people know what we are doing, our successes, and then we also share our challenges. And that way we have been able to build a lot of confidence with our partners. Media engagement, the way I said, we have been having we have a health journalists forum, email address where we share all our press statements. And so this has really been helpful. Every month we dedicated ourselves to be releasing press releases. And so like for this year alone with cancer and COVID, we released our presser during the World Cancer Day. We did one in March when Kenya got its first case of COVID-19. We released a presser and we asked the government, we need cancer guidelines to be released, cancer management guidelines in COVID-19. And we are happy, actually 2 weeks after we released our position paper, the government, the Ministry of Health released cancer guidelines. And most of what is in the guidelines is what KENCO had actually suggested to be put in place. So in May, during the National Cancer Survivors Day, we released a press statement again highlighting the plight of Kenya of cancer patients. In June, that is when we were marking our first 100 days during COVID-19, and we released a press and we argued, we called on government. The numbers in cancer are higher than the numbers that people have with COVID-19. So why are all resources being diverted from other sectors being taken to COVID, yet cancer control has higher numbers, yeah? And we have seen changes over time. September, this is Childhood Cancer Month. Again, we highlighted issues on childhood cancer and the challenges parents with children with cancer go through, the high cost of treatment. And we know we've got some attention with government. So this will continue. Our plan is that we will have achieved our advocacy goal by 2022. This date we set because our next elections will be in 2022. The current government has highlighted health as a big agenda for them. So we are trying to take advantage of this environment at the moment and see how far we will be with our campaign by that time. Then, of course, supporting our members, we have managed to fundraise. I know it is a really hard time for cancer societies across the nation, the world to fundraise, but we are happy that we've been able to fundraise through global giving, March, July, and recently in September, and we cannot complain. We have raised some good money for cancer education materials. We managed to do a dinner just before the COVID case in Kenya was announced. We fundraised some money. Pharmaceuticals have been giving us money gradually, not as much as we need, but gradually there's some change. And with this money, we are able to support our members. So those are just photos of some of the activities that we've been able to do. And we are really grateful to UICC for this Cancer Advocates Program. When you write to UICC anytime with any challenge or any sort of help that you need, they always answer you within 24 hours, and that has really been beneficial for us. We get to learn so much from them, and we are really grateful. Thank you so much. Over to you, Eniko.
Thank you very much, Christine. It was a very comprehensive presentation that gave us an idea of your advocacy efforts, and it was great to hear from you and from Tsegi the progress that you have made in your country and the way you master a lot of different subjects that are really fundamental to sustain advocacy efforts. Subjects spanning the knowledge of the national, let's say the public health system, how to engage key decision makers, how to raise funds to sustain the organization in the short and in the long term. I would like to use this opportunity to share a couple of points. The first one is that Fanny and I, we learned a lot from the 20 country champions that are part of the Cancer Advocates program. We really learned how resilient and strong they are in carrying out advocacy activities and support to cancer patients into their countries. And you know, the word of appreciation also referred to the way they reacted to an unforeseen pandemic, because despite the circumstances, the country champions really managed to step up efforts to support cancer patients, to help them access treatment and care during COVID-19 and during the lockdown, to liaise with governments to make sure that the cancer patient could access services, treatment, and care. They also stepped up efforts to turn their in-person advocacy into virtual advocacy, creating a sort of a storytelling and narrative around their digital strategies. So thank you very much again, Christine. Thank you very much again, Tsegi, for your presentation. And I think we can switch. Switch to the final 15 minutes of this session, where we would like to hear from you, from all the participants. If you have any questions regarding the learning experience and the learning opportunity of the Cancer Advocates program, and if you need more details, more information to apply to become a country champions. Because as you know, as I said at the outset, we opened the call for expression of interest the 15th of September, and we will close it the 15th of October. On the UICC website, there is a link to the submission form with a few questions that we would like you to answer in order to be considered for the final short list. So if you have any questions regarding this process, or if you have any questions regarding the support, the technical support that the Cancer Advocates program provides to the UICC members, I think we have some 15 minutes to do this. And please let me know, Alessandro, if you agree with this.
Absolutely. So I suppose any question. I was particularly curious about the presentation of Christine, for example, and when she mentioned her approach to the Treasury as well. How was it received? But again, questions invited to the whole audience, either for the process or even if you have any question for the particular strategies that have been presented. Otherwise, we can go with my question to Christine. It's like, I'd be curious to know, how was your approach to the Treasury received? Often it's said that when organizations of civil society approach the Ministry of Finance or the Treasury, they usually find closed door. And how did you find your reception in your advocacy directly to the Treasury?
Well, maybe what I can say is that the Treasury and the Parliament, they usually do frequent memorandums in the newspapers, and they ask for the public to comment on a certain issue. So we usually go through, we ensure that we are constantly in touch with media, so that once such a memoranda is released, then we get to know it. It is usually open for like a week or two, and we get to write on issues, various issues that they have highlighted. And they ask for suggestions, maybe how would you want this done? Or what is your thinking on this? So we have always ensured that now we call our members together and we get ideas from all of them. Then as Kenko now, we do a write-up. One of my colleagues is here, Charles Muya, he's really been really supportive in doing such write-ups. Then a date is set when now they have different members, maybe civil society or different participants all come together in one room, and we get to present our findings or our feedback. Yeah, and so far it has been good because they actually get to listen. There are questions that they will ask, maybe if an issue is not clear. Yeah, and yeah, that is how we have been doing it. They might not say it at that time whether they are going to respond or not, but we find that notes are taken. There are times they've actually followed up and requested that from maybe the discussions we've had, we write back to them and give maybe a formal communication, and we write that and we send it to them. Then we have found now, for example, what we are saying, like the National Cancer Institute of Kenya, that is a semi-autonomous government body that is mandated to give advice to the government on matters cancer. One thing we highlighted the last year is that they didn't have enough staff. There was just the CEO with no staff and a board. Yeah, the year before we had highlighted that they didn't have a board. So last year we highlighted they didn't have a board. And within 3 months of us raising that, the Ministry of Health actually posted enough staff to that, to the semi-autonomous body. Then we have realized that in this year's budget that was read in June, actually the National Cancer Institute has received more funding. Yeah, we have kept raising these in various presses and even to Treasury, and we have realized NCI now has extra funding. So we are seeing some fruits gradually, yeah, but it will take time, but we know it is gradual and we are seeing some fruits. I hope I have answered you.
Thank you, Christine. And I know there's a question about from Gamal Amira. I'm going to unmute you, Gamal. Please go ahead.
I am Gamal Amira from Egypt National Cancer Institute and Egyptian Societies of Cancer. In Egypt, we have a vast experience in cancer management and detection. We have many well-equipped and old institutes like the National Cancer Institute in Cairo. It is now 53 years, the first in Africa and in the Arab countries. And we have good experience in surgery and in radiotherapy and chemotherapy treatment. And I suggest cooperation between Egypt and the other African countries, and to share experience and to do something like coalition or combined researches under the UICC. And the question is for Christine, how to establish this cooperation for the development of experience between African countries. Thank you.
Okay, if I've heard it right, you're asking about how to build a coalition for African countries. Okay, maybe what we can say, well, I'm from Kenya, and when we identified the partners we needed during the coalition building module, we approached them, yeah? I know it requires money to form workshops. That was one of the challenges that we had. It requires money to call people together, but we decided, because we didn't have the resources at the time, to go it step by step. So with the national, like the religious leaders, we had meetings with them. We tried to explain to them we do not have money. We are civil society, completely not for profit. And they came on board. Of course, they wanted some money to have meetings and all that, but we told them we'll use the small resources that we have. So we first had meetings with the high-level officials, the high-level interreligious leaders. Then they later called the other levels for a small meeting, and we were able to have discussions. So far, 3-4 meetings we've had, and we've seen now some fruits. For example, when we had the press conference, that was a really big thing for us. If it is other partners, like when you're having coalitions with the NCI, the National Cancer Control Program, the NCD Alliance of Kenya, now those ones are just discussions you have. You walk into the office and you have discussions why you need to work together, why it is important in cancer control. Yeah. Now for the other countries, for example, I'm in touch with my colleague, the country champion in Uganda, in Namibia, we have a CEO in Sierra Leone. So those are just partnerships we formed. When UICC does the monthly calls and you realize a colleague from another country has said something really good, you approach them on the side and you say, you know, you shared something really good during the UICC call. Could you please guide me maybe on this? How is it different from what you are doing? You know, all that. And also during the meeting in Kazakhstan, I got to interact with a number of people from different countries, share experiences, and we changed contacts. So that's how we've been keeping in touch. Once you get a contact, to communicate with somebody. I hope I have answered your question, Gamal. So that is why it's really important. If you get selected for this program, you get to interact with so many people. Thank you.
Thank you. You talked about your national program and the cooperation with few countries. I want to expand this cooperation between all African countries and to share experience for the whole continent. And I want to make a meeting or something like that under the UICC for the African societies or African countries to make a coalition and to have our programs and our experience.
Thank you, Gamal. I think this is a very nice idea. We have seen how it's easy, oftentimes, for UICC members coming from same regions or neighboring regions to cooperate, because most probably the needs are very similar. So when the needs are similar, and maybe also the let's say the socio-political context is similar, maybe the solutions can be it's easier to share common solutions. We have seen this in the Cancer Advocates program, a lot of solidarity and unity between country champions from the same regions, and it's something that we would like also to scale up as we are keen to form a new cohort of country champions for the Cancer Advocates program. But also there is a standalone regionalization effort, let's say, within the UICC's capacity building team, aiming to unite members from the same region to discuss good practices, lessons learned, how to overcome some challenges together. Maybe we can also put you in touch with our colleague Melanie, who is leading on this specific stream of work within UICC. We still have time. I see that we still have time to take a few other questions regarding the program, regarding let's say the needs of cancer advocates on the ground. So if you have any questions, please feel free. Please feel free to do that. Otherwise, I will ask questions also to the audience or to specific country champions. Okay, so in absence of questions, I would like to make a question to the different UICC members that are participating into these calls, cancer advocates, representatives of cancer organizations. We know that this program was designed before the pandemic, and we also adapted the offer in terms of technical support to the participants of the program, to make sure that we manage to address their needs and concerns. But I would also like to understand, from you participants, how what kind of support you would like to receive in terms of capacity building for advocacy. What are the most pressing and urgent needs that you would like to tackle? For instance, is it about how to engage key decision makers? Is it about how to improve communication with the people you serve? Let's say the cancer patients. It's about the skills and knowledge to raise funds, for instance. Or it's something related to the collective efforts. So how to create a coalitions if in the same country we have different organizations, they are focusing on cancer, but different aspects of cancer. So how do we unite behind a common purpose? So I would like to hear from you, if what are your current needs? So I see a question from Alejandra. Thank you, Alejandra, for your questions. So you said that you would like to know if the practical guides that we have produced, the practical guides on coalition building, advocacy, fundraising, and monitoring evaluation can be shared more widely with other local organizations. Yes, this can be done, and we are really happy. We are really happy to do so. I would suggest your organizations, Alejandra, to apply to let us know what your current advocacy efforts are, because this also gives us an idea of maybe what your current needs, are, so that can also use the self-assessment of needs and the other modules to sustain your advocacy efforts. So I would encourage you to apply, even if Mexico is already a country champion. But the resources and materials that we produce these are tools that should be made available at country level. So feel free to apply. Yes, so Professor Sani Malami saying from the National Cancer Society in Nigeria, who is a country champion. He's echoing the message from Alejandra, saying that it's very useful. So the modules are very useful and should be shared with local organizations. And I would also like to seize this opportunity to commend the efforts of Professor Malami to convene a meeting within the framework of the Cancer Advocates Program. So earlier this year, he organized a meeting with several cancer organizations in Nigeria to build a coalition and to agree on a few advocacy priorities. And Professor Malami, if you would like to maybe in a couple of minutes share your experience, you're more than welcome.
Thank you very much, Alexandro, and a very good morning to every one of us on this program, and especially our presenters. As Domenico has mentioned, we in Nigeria organized a program earlier this year, just before the pandemic became a global phenomenon. And one of the achievements there was we were able to build a coalition and also to get the representatives in the National Assembly to agree to pass the law, which has now provided funding for cancer control. This has never happened before because previously the cancer funding in Nigeria was dissipated in very many in a kind of silos. So we were able to get a substantial funding which has been appropriated for cancer. But as you know, the political space is always very, very interesting and surprising. We are now struggling, which has been appropriated is actually spent for cancer control. And now there is a lot of pressure, as you know, with regards to funding in so many areas, not only in healthcare because of the pandemic. And so this is another struggle, another phase of the struggle that we've started. And so today we are having yet another meeting, which is not actually organized by the National Cancer Society, but is bringing a lot of cancer CEOs together. And one of the points I'm going to make in that meeting is that the need for us to come together once again to see that the money which has been appropriated, which has been budgeted, is actually spent in cancer. So this is a continuous struggle. And what we've done in Nigeria, which is perhaps different, is we've been able to rally around a single kind of advocacy idea very well, and we're working all together towards it. So thank you very much.
Thank you, Professor Malami, for your contribution. Alessandro, just let us know if we have just a few more minutes. We were supposed to close right now, but if there is any other question, maybe we can take the last question, and then I will hand over to Alessandro. Yeah, I can also see a comment from Carmen. Carmen from Cancer Warrior Foundation in the Philippines. Thank you, Carmen, for your comment on the concepts of COVID-19, that cancer has become the forgotten C. And cancer patients are experiencing discontinuity of care, delayed diagnosis, treatment, etc., as well as financial issues, given that there is a concern that there will be a surge of advanced cancer cases. I think this is the situation that we are all, we are all facing in all countries. And this is the reason why we are really keen to provide increased support to make sure that cancer elevates to the top of the national health agenda. Cancer receives a lot of importance, and civil society representatives of cancer organizations, they managed to liaise to better engage key decision makers to make sure that there are policies, there is legislation, and there are funds to sustain cancer control in countries, and this is really important. Thank you, Christina. She said it's always a pleasure to participate in these dialogues and to get knowledge with wonderful experiences. I totally agree. We really witness wonderful experiences in different regions of the world. Juniati also shares the concern from Carmen that the situation, is the same in Indonesia, and this really prompt us to continue to provide support on advocacy for cancer control, to make sure that no cancer patient is left behind. There is a nice suggestion from Carmen, which is something that we may take into consideration. Thank you, Carmen, for the suggestion on making sure that the voice of civil society, UICC members is heard at all levels. Thank you, Carmen, for the suggestion. So I think, Alessandro, the time has come to hand it over to you.
Thanks, Enrico. It's really just a thanks, everybody. I think the participation again is this was just a very brief dialogue to showcase the experience of Counter Champion and sort of put out the opportunities to apply for the next cohort, but also again to bring us all together in time that, as Carmen was pointing out, are quite difficult for cancer as it risks to become the forgotten C. But again, as I've heard our CEO also say, that there will be life after COVID, there's no life after cancer. So the work that you're all doing in your countries in terms of bringing the agenda again back to cancer control and the issue around it is absolutely important, and UICC is here to support you. Thanks everybody for the participation. Do check in on our upcoming special dialogues. We will have conversation around cancer beyond COVID coming up in November as well, where hopefully we're going to explore some of the issues raised by Carmen, for example. And have a fantastic rest of the day, and thanks for participation, and see you soon, everybody. Thanks, Enrico, and thanks, Fanny, for organizing, and thanks, Seke, and Christine for presenting.
Thank you.
Hi, everybody. Good night.